Welcome to the London Asthma Decision Support Tool demonstration. Here is what we will cover today, briefly. The structure and timestamps available in the video description help you jump to any section in the video. Accessing the tool, primary and secondary care users. Go to the WYSIC homepage, click Population Health, select the inhaler icon. From here you can visit the landing page or jump to any section of interest. Population health users. Find the Asthma LATS tool under the long-term condition population health category. LATS tool landing page overview. It provides a high-level view of asthma across northwest London based on the QoF algorithm. The dashboard is split into 4 quadrants: population, clinical, finance and wider determinants. Click the arrows to dive deeper into each category. I will start from looking into population detailed dashboard. The Asthma LATS tool brings together primary care, acute care, medication, demographic and environmental data to support asthma improvement across London. You can hover over the information icon here to learn more about the data provenance used in the dashboard. It is designed for primary care teams, PCNs and practices, ICS and ICB program teams, respiratory networks and clinical groups, commissioners and managers. It supports decisions around identifying variation, targeting improvement activity, monitoring outcomes and understanding the needs of specific groups of asthma patients. You can click on the user guide link here to learn more about the example of purposes and use cases for the dashboard. They can be found in the section 1 of the user guide, just down here. Also, in the user guide you will find the calculated definition sections, which allows you to see the definition, logic and codes used in relation to every single metric listed in the dashboard. On the population overview page, you will see a breakdown of Northwest London asthma patients by health borough, PCN practice, gender, age band, deprivation and ethnicity. Interactive chart shows total and new asthma diagnoses over recent quarters, mortality rates for children and young population as well as adult deaths, asthma patients with comorbidities and by key comorbidities, by age and gender, by emergency department visits and GP appointments after emergency department events, inpatient spells and ED visits by geography. These insights help identify population patterns and potential areas for improvement. The purple banner at the top of each page shows the latest data and refresh date. Let's walk through a simple scenario. I want to understand which PCNs have the highest number of asthmatic patients with 5 and more asthma-related emergency department attendances in last 12 months. I need to make sure that my tooltip detail reflects PCN. I drill into 5 plus bar here, and I can see that the Marblewood PCN has the highest number of asthmatic patients with 5 and more asthma-related ED attendances in last 12 months. A user might use this insight to plan targeted reviews, education sessions, or medications optimization. The dashboard is interactive. Clicking on any bar updates the other charts accordingly. To reset the view, select View Original. Use the top tabs to navigate between the LATS tool pages. I am now going to view the population map. Population map. It visualizes asthma prevalence geographically. Apply filters for health borough, PCN practice, gender, age band, deprivation or ethnicity. Select map detail if borough, PCN or practice, and data overlay. I'm selecting asthma patients with comorbidities by PCN. Hover for detailed info. Metric summary. At the top you will find interactive filters allowing you to drill down into specific patient groups. Below the filters, key headline figures gives you a quick snapshot of population in cohort, asthma patients in cohort, asthmatic patients with comorbidities, and asthmatic patients under secondary care and A&E attendances. Next, you can explore selected metric using this filter here to see visual breakdowns by health borough, primary care, ethnicity, and deprivation. At the bottom of the page, you will find out a table which provides a granular insights, including asthma reviews, inhaler technique checks, personalized care plans, emergency visits, and prescription patterns. And you can decide if you would like to view this by health borough, PCN, ethnicity, deprivation, or ethnicity and deprivation. I am selecting the view ethnicity and deprivation. This data supports quality improvement and targeted interventions. Clinical detailed. This section focuses on clinical considerations for asthmatic patients. Use the top row filters to narrow your view to specific patient cohorts. Indicators update dynamically based on your selections. Key features: quality assured diagnosis, peak flow, FEV, over time, and this can be seen broken by health borough, PCN, or practice. Asthma annual review, inhaler technique, personal plan, ACT, over last 5 years, can be seen as total number or percentage of total. Number of medication prescriptions over time, seen per borough, PCN, or practice, and DPI versus MDA ratio for bottom 10 health borough, PCNs, or practices. If I select PCNs and hover over one of the segments, I will be able to see practices within that particular PCN. Wider determinants. This section allows analysis of smoking or body mass index over time, asthma patients by deprivation and first language, 10 most deprived or 10 least deprived by health borough, PCN, or practice, and asthma patients by ethnicity. Ethnicity can be viewed in summary or detailed formats, following national coding standards. Wider determinants map. Visualize social and demographic factors geographically. Filter by residential borough, ward, health borough, PCN, or practice. Apply additional filter for gender, age band, deprivation, and ethnicity. Choose data overlay. I'm selecting total asthma patients and acute service department type for deeper insights. Darker map segments indicate higher patients number based on your criteria. Hover over any segment for detailed information. Download data in multiple formats by clicking on the download button here. Finance detailed dashboard helps analyzing financial impact. Primary care asthma related activity. You can choose between all costs, annual review, and annual review DNA. Acute care activity, all cost inpatient critical care, A&E outpatient and outpatient DNA. Hover over the graphs to find out the exact figures. Asthma medication cost by health borough, PCN, or practice, and you can view this as total number of prescriptions, prescriptions per patient, or prescriptions per 100 patients. Also, bottom 10 average length of stay by health borough, PCN, and practice, and admission type, elective, non-elective, and unknown. Hover over information icons for calculation logic and supporting links. Click bars to drill down. Use reset filters to return to default view. Please feel free to pause here to read the key takeaways from this video demonstration. For access or feedback, please email nhsnwl.wizigsupport@nhs.net. Dummy data was used throughout this demonstration. Thank you for watching.